Okay, I have 1 minute after 2, so I think we will go ahead and get started. Good afternoon, everyone. My name is Jill Kagan with the Arch National Respite Network and Resource Center. Thank you all so much for joining today's webinar on cultural and linguistic competence and what they mean for respite services. I did just very quickly want to provide a couple of housekeeping chats. If there is anyone out there who still has not used Zoom, I thought it might be helpful for you to see this menu. For most of you, that should be along the bottom of your screen. If you don't see it, you can hover over it and it should bring it up. We have muted everyone upon entry, but you do have the capacity to unmute yourselves later if you want to ask a question. But we would appreciate it if you could remain muted during the course of the presentations. We will be monitoring questions through the chat platform, and you can see that little chat bubble in the middle of that menu. If you click that on, you'll be able to enter comments and questions into a little box. And we'll be monitoring that throughout the presentations. And please feel free to type in your questions or comments at any time as you think of them. We may stop, depending on how we're running, how time is running, right after the first presentation to see if there are any questions. Otherwise, we will wait till both presenters have presented for opening up the Q&A. We are recording the webinar, and it will be available for viewing once it's been archived, which should only take a day or two, and we'll notify everyone by email when it's available. I did send the PowerPoint slides around to all of you who were registered before the webinar, but I'll also post the links in the chat platform in a few minutes, and then you can download them directly from there. We have a lot of new people on the webinar, I noticed, that registered who may be new to Arch, so I just wanted to share some information about who we are in case you're not familiar with us. We are funded by the Administration for Community Living to house the Lifespan Respite Technical Assistance Center. And that center primarily supports state lifespan respite grantees, which is a federal program that helps state agencies and their partners develop statewide coordinated respite systems that serve caregivers of individuals of all ages and all conditions. We also, and we have since 1990, provided training and technical assistance more broadly to our state respite coalitions, to service providers, to the general public, and generally to the respite field. And we also provide assistance to families and caregivers through an online national respite locator service that helps them find respite services and respite funding sources in their local communities. And then finally, we also work through our National Respite Coalition, which is the policy division of Arch. And you can connect with us at any time through our website at archrespite.org, or at any of those links you see on the screen. We do have a very content-rich webinar today, so I'm going to dispense with all of my usual announcements and go right on to introducing our wonderful presenters. I'll let them share more about themselves, but our first speaker is Tawara Good. She's the director of the Georgetown University National Center for Cultural Competence and director of the Georgetown University Center for Excellence in Developmental Disabilities. Our second presenter is Jed Johnson, managing director in aging services at CARF International. And we're also very privileged to have Jed serve on the Arch Advisory Committee to the Lifespan Respite TA Center. So a very big welcome to you both, and thank you so much for taking time out of your busy schedules to talk to us about this important topic. And I'm now going to turn the floor over to Tawara, and I will stop sharing my screen, and you can go ahead and share yours. And welcome again to both of you.
Okay. Thank you. Thank you so much for the opportunity to share our work with the Respite Network. I'm just going to move right along. We have a lot to cover in an amount of time. And I don't need to do any more introductions. What you shared already, Jill, is just sufficient. So we'll advance the next slide. So what we're going to do today is to really look at culture and cultural diversity. We're going to look at the multiple dimensions of culture and what does that mean? What does that look like in respite care? That says long-term care should not be there. Sorry about that. Describe conceptual frameworks for cultural competence and linguistic competence. And we'll look at how do you apply these frameworks and concepts to the full array of respite supports and services. So basically, we just really can't talk about cultural competence at all unless we have some shared understanding of what culture is. So I want to start off to help us really think about this scenario. And I want you to have that in the back of your mind as Jed and I both share our perspectives. And so just think about it. You can use the chat feature as we go along. We're going to revisit it toward the end of this presentation. But a state respite coalition has been meeting to address disparities in access to and utilization of respite services. An analysis of data indicates an underrepresentation of both by geographic locale and by diverse racial and ethnic groups in the families who are actually accessing these services. Several coalition members have continued to emphasize that there's a difference within the state's diverse communities in their understanding of exactly what respite is, reluctance to have strangers care for their loved ones, and lack of trust of some human service providers in the state. So I want you to just be thinking in the back of your mind, what are the cultural factors that are presented by this scenario, and what recommendations about community engagement would you propose as a member of this state stakeholder group? Okay, we're looking at exploring the multiple dimensions of culture. At the National Center for Cultural Competence, we have an array of definitions and ways that we hope to help you think about culture. So as we think about culture as learned and shared knowledge, it is what groups have inside them, how they interpret and view the world. It includes all the things that you see there in the ovals and many, many more that just simply couldn't fit on this page. So that it's looking at how we communicate, our language, how we behave, ways in which we interact. What's important and I think also amazing about culture is that culture is passed down from generation to generation. There are aspects that are passed down to generation, and then there are aspects of culture that constantly remain the same. We know that culture is very broad. It can apply to a racial group, a religious group, a professional group, a social group. What I find amazing about culture is that while there are many aspects of culture that remain the same, culture is also constantly changing. And as I think about technology would be an excellent example of how much technology has changed and changed the ways that we have communicated. We also know that culture is what people perceive, what is their reality. And it also looks at how they respond to the environments in which they find themselves in. We right now are in an environment of a pandemic, and it literally has changed the culture of our country. And I want us to think about culture in a very broad way. Culture is reflected in our customs, our technologies, our survival strategies. Culture affects how we love, marry, illness, wellness, disability, and end of life. So that when we think about culture, it permeates everything. Culture is also akin to being, I love this image that's used. It's like thinking about us from a one-way mirror. And as we think about culture, often what we typically view are things from our own lens, from our own cultural perspectives. And as we think about cultural competence in particular, it's about really being able to get to the other side of the glass. It really is about being able to see things from a perspective other than our own. And while it's very easy to say, it is often very, very difficult to do. Again, as we think about culture, it applies to everyone. And I think in this country, we often don't always think about culture. We tend to think about race and ethnicity. And while those are interrelated, they're not the same. And so I really want us to think about culture so it's applicable to everyone. It is multi-layered and multi-dimensional. that it gives every group member their identity. It really permeates every aspect of life. And so I want us to really think about culture in this deep and rich way. This is an iceberg concept of culture. You probably have seen this before. And I use this a lot in our training, particularly when we're doing interactive activities. And it's a sad looking little iceberg because I drew it. And that line across the top is the water line. And oftentimes when we think about an iceberg, or what we know, is that only about 1/10 of an iceberg is visible above the waterline. Everything else is submerged. And we can use that as an analogy with culture, so that a lot of times people may pay attention to how someone dresses, or what their age may be, or their physical characteristics, or that they may guess they can tell their racial or ethnic identity. Those are just things that are above at the surface level. They don't really tell us deeply what's going on with individuals, children, and families, including those that are in need of respite care. So that we can't tell by looking at someone what their child rearing practices are. We can't tell by just looking at someone their concept of justice. And so I think this is a very interesting exercise. I usually, when I'm doing it, get people to guess about me. We simply don't have the time to be able to do that this day. But I think that Jed is going to help us along in what he's sharing with us later. This is a way of helping us to think about culture, and it's called addressing, and it is a model that was done by Pamela Hayes. You will see some things are in quote in parentheses, and I included it. And so as we think about this model, addressing, it really helps us to think about the various cultural identities that people have. So we're looking at age, disability, and disability can be congenital, as in born with a disability, and or acquired. This model includes religion. I can't assume that everyone may be religious, and so we included spirituality or no affiliation. Ethnicity is the appropriate term. However, many people in this country focus on race. However, ethnicity is the correct term, so we needed to include race. And then we look at socioeconomic status, sexual orientation, indigenous heritage, national origin, and gender. I included gender identity and expression. And so this is just an easy way for us to think about the degree of diversity that we have and what these factors may be as how they play out in respite services. So I'm going to offer you your first question. And I'd like for you to use the chat feature. And if you could just put question 1 and then your response. So as you think about your role or capacity or your experience, which element, as in 1, of addressing do you consistently consider as a diversity factor as it relates to respite services? And which do you tend to overlook? So put 1 for what you consistently do and 1 that you tend to overlook. And again, using the addressing model that's there. Just wait a couple of minutes. And I'd like for you again to put this in the chat feature. All right, we're gonna move on. Hopefully you got started with that, that you got your 1 in, and then 1 that you tend to overlook. As we think about culture, it's important to say that we all have multiple cultural identities. And I'm going to go through this really, really very quickly, that there are what we call categorization. And that's when we may have one identity that we draw upon. And we would say that really includes everything that I am as a person. Some people who have disabilities strongly identify with their disability. However, it is only one of their cultural identities. Then we look at compartmentalization. And that means that people have many different cultural identities, but they maintain them separately. And say, for instance, you may be meeting someone for the very first time in any aspect of respite care and services supports, and they may choose only to share a part of them. Just they're not going to share all of their identities with you for a variety of reasons. So we think about that as compartmentalization. And then there are people who integrate all of their cultural identities. And I have some examples. An example I think is really poignant that I will share with you now. Then we look at intersectionality. And as we think about intersectionality, and I'm not sure what happened if I mixed up my slides here, and I may have. We look at intersectionality. This is Kimberly Crenshaw, and the work of Kimberly Crenshaw, that she basically looks at that we may have many different identities, and because of those identities, we get treated badly by society. And so in her initial work, it looked at being female and also being Black or African American. However, as we look at the concept of intersectionality, it really has moved from just looking at those two to encompass many other things, including sexual orientation and disability. What's important about this concept of intersectionality, and many in the disability community are using this term in particular, is that intersectionality is not positive. Intersectionality is not positive at all. It is really looking at, because of your membership in multiple social groups, that you're marginalized, that you may be oppressed, or you may be discriminated against. And so I'm encouraging people to really understand what intersectionality means versus what is multiple cultural identities, when that there are all of these identities that someone may have. So this is reflection question 2. And I want you to think about it. And again, put question 2 in the chat feature. As you think about the state lifespan respite grant programs, how much attention do these programs pay to multiple cultural identities and intersectionality? And so that is looking at it across the board, whether it's program design, whether it's staffing, whether it's onboarding or in-service training, or whether it's evaluation, because we're talking about people and how people view themselves. So I want you to, again, enter your responses in the chat feature. Thank you. Lastly, we've talked about culture from the perspective of people. I just want to talk about organizational culture. So that when you look at respite and the array of respite services and programs across the country, each organization, program has its own culture. And so I think it's important for us not to think about culture only as limited to people and or populations, but to really think about the organizational culture of those that you may be affiliated with, volunteer with, or employed with. So as we think about this, I have these rules. It's that we really have to have a solid appreciation and understanding of culture. And that would be from the way in which we've been talking about it in terms of your own culture and the culture of others. Then that helps us move along the journey toward cultural competence. So quickly, we're going to look at what is cultural diversity. As we look at the demographic makeup of the United States, and this is the most recent data from the census, gives us an idea of who lives in this country, including our territories and untraveled nations. And so if we look at these data, I want to call your attention to a couple of things. Toward the bottom, you see some other race. So a full more than 5% of the population says that those categories that are listed there don't apply to them, that they self-identify in some other way. And also the next one, 2 or more races, which is actually the fastest growing demographic in the US, how people self-identify in this way. And so as you think about respite services and the diversity of people who may be seeking and receiving such services, that, you know, are there data collection methods and things that you're doing in order to have people to self-identify? And also looking at these categories in particular, that some of the categories indicate that some people just simply don't self-identify in that way. So for you to really think about what does this pattern look like in your state and or local community as it relates to respite services. And so as we think about cultural diversity, again, this is a term that we use to really look at the broad range of, quote, diversity within the populations. And it can include racial and ethnic classification or tribal affiliation. It can include nationality. It can include gender identity or expression, socioeconomic status. It can include intellectual abilities. But it really is helping us to think about this in terms of how we distinguish one group from another. So if we look at these cultural factors, and these are many, obviously we won't be able to go through all of those today, but I want you to really think about how much culture really permeates our lives and what that means in the context of respite. And so I just want to share for the first one, cultural, racial, and ethnic identity. Oftentimes people use these terms interchangeably and they're all very, very different. And I always use the same story of a colleague who's out in Oregon, who's doing training. And in that training, there was only one person of color. And as he talked about issues pertaining to African Americans, he kind of looked over at her. And on break, she came up to him and said, "Hey, Dr. Mason, I appreciate all the personal attention you're giving me this morning, but I'm Panamanian and I mean it." And he had made an assumption because she was Black that she had to be African American. She's from Panama, totally different country of origin, totally different language, totally different culture and traditions. And so we really have to attend to these various internal factors as it relates to individuals that we provide services to in terms of respite care. And so again, what does the lived experience of disability or mental illness mean? All being able to view this from a cultural lens. As we think about this, we also can think about internal and external factors. Sometimes there are communities that have not felt necessarily welcome. And so that even though they're eligible for services, may shun getting to services because they're afraid of how they may be treated, how they may be received. So these are all the things that may impact, as we think about that particular scenario that we looked at, access to services and supports. And so just by virtue of these definitions, and these I retrieved from the ARCH website, that as we think about, again, this whole notion of culture and what does it mean in terms of respite, we look at these definitions. Respite is planned or emergency care provided to a child and adult with special needs. So it's not as if those children or adults exist outside of their culture. So that we really have to attend to that. And then if we look at lifespan respite, it's a coordinated system of community-based respite for these caregivers, children, and adults, regardless of special need. And so again, what does respite mean in the early stages of one's life, toddler through school age, versus at later stages of life? All of these have cultural implications. So rule number 2, we have to be able to recognize, respect, and respond to the within-group differences among all persons who are receiving lifespan respite care. Now, that was our quick on culture. Now we're just going to talk about what is cultural competence. I use this slide because we see all of these terms in the literature and we hear people saying them. And I suggest to you that they all mean something different. Just because I'm culturally aware doesn't make me do anything different in my work. Just because I'm sensitive doesn't make me change policies and procedures. And so what I want to share with you is a way of thinking about cultural competence. Again, that there may be different definitions that people have used with cultural humility. This one there, it says cultural dexterity. We did some work with some surgeons and they thought that that would be a better thing, that surgeons could relate to dexterity. Again, I suggest to you they all mean something different. I'm sharing with you a framework to think about cultural competence. It was done in 1989 in child and adolescent mental health. And this is the work of Terry Cross, Barbara Bergeron, Carl Dennis, and Marisa Isaacs. And as we think about, again, this work, they're saying that when we think about cultural competence, that first of all, you have to have clearly defined values and principles. And within disabilities, special healthcare needs, We have values, and they are clearly stated. However, what this is saying is that those values have to align with what your policies look like, what the structures in an organization would be, what the practices that we see, behaviors and attitudes. So in other words, you can't say, for instance, you value diversity, but yet you do nothing different to respond to diversity within children, families, and the communities that require respite care. And so basically what this is saying is that all of these things, behaviors, attitudes, policies, and structures, they have to be in effect, and then it will allow you to work effectively cross-culturally, not cross-racially, not cross-ethnically. We're looking at culture really very broadly. As we think about cultural competence at the individual level, there is again, having the capacity to acknowledge cultural differences, which is part of what we're doing today, and also part of what our scenario is telling us to do. You have to understand your own culture. It's very difficult to talk about cultures of others when you first don't really have a good understanding of who you are and what your multiple cultural identities are. The next is being able to engage in self-assessment. At the National Center, we've created numerous assessment instruments that really look at cultural and linguistic competence. And so as you think about engaging in self-assessment, it's where am I at any given point in time in my relationship to serving or supporting diverse children, adults, and their families and communities. And self-assessment can be a tool. It also can just be reflection, that you're reflecting on an interaction that didn't go well, and that you're able to say, what happened there? Were there cultural barriers? And so again, these are really important elements. Fourth one is to acquire cultural knowledge and skills, which means that cultural competence isn't a workshop. It isn't reading a book. It's not seeing one video. It really is a process in which you are committed to gaining knowledge about individuals and groups that you don't know, and then putting that knowledge into a skill. So for instance, I know some Spanish. However, I don't know enough Spanish to maybe conduct an interview. And so an example of this would be the skill I need is not that I'm going to learn Spanish overnight. My skill is being able to work effectively with an interpreter. And so really understanding cultural competence from that perspective. And lastly, we have to be able to view behavior within a cultural context, because culture impacts what it is that we do each and every day. When we think about cultural competence at an organizational level, it's that organization, again, has to value diversity. And as we looked at the racial and ethnic demographic profile in the United States, there's a great degree of diversity. So we can't say we value it. We can't just have it on our website and have a lot of different images of a range of people. It really has to be reflected in that organization, from the policies and practices all the way through. The next is being able to conduct self-assessment, to be able to really assess where is my organization in terms of serving the diverse children, families, and adults that live in my community or in my particular state, and to be able to look at that and say, hey, this is where we are, but we need to be in another space. So being able to conduct self-assessment is important. The third is managing the dynamics of difference, meaning that we're all different. We have many similarities as well as human beings. However, it's not our similarities that cause us problems. It's generally our differences and lack of understanding. So we have to be able to manage those dynamics of difference. And again, I want you to think about what this means in the scenario that I shared earlier, to be able to manage those dynamics of difference, whether it's through staffing, whether it's in engaging families, whether it's interacting with communities. The next is being able to embed cultural knowledge. The original framework used the word institutionalized. That has a very heavy meaning for many people. I'm acknowledging their original work, yet introducing a new word. And so when we look at embedding cultural knowledge, that means that there just can't be one person in an organization that knows how to work with this group or has a good relationship with this particular community. That we really have to be able to embed that knowledge, helping people to learn this over time. And lastly, in a culturally competent organization, you have to be able to adapt to diversity. say, for instance, your demographic makeup in your state looked one way, and now it looks very different. You may need to go back and revisit your policies and your practices to ensure that you are indeed being able to serve all residents within that particular state. Lastly, as we think about cultural competence, it has to be at every level of the organization, at the policymaking level, at the administrative level, at the practice and service delivery level, at the individual and family level, and at the community level. And I say this because oftentimes, and even what we see in the literature, is that a lot has been done about what happens at the practice level, individual to individual. However, what we know less about is how does this look across all of those levels? And I suggest to you it's very difficult to be, say, a culturally competent respite provider in an organization that doesn't support you with policies, procedures, and resources. And so this is the way we think about cultural competence overall. So, and this is your reflection question 3. And please write question 3 so that Jill will know what you're responding to in the chat feature. And I'm asking you to respond to this. Has the organization or program in which you are employed or a volunteer reached consensus on what cultural competence means and how cultural competence relates to its mission and work? And your response options are yes, no, or you simply don't know. So we'll take just a couple minutes for you to get started and to enter that into the chat feature. Okay, all right. Now we're going to talk about linguistic competence. Again, we'll get through this quickly. I have a bunch of slides that I am not going to go into details with. They're there for your reference and for your information. So I may just acknowledge them and scroll to the next slide. This gives us an idea of, again, this is the most recent data that we have from the census. The 2019 data will be coming out sometime in the fall. But this is just a snapshot of the kind of languages, the number of languages and the types of languages that are spoken at home in the United States. And you see that the census puts them into categories: Spanish, Indo-European languages, Asian Pacific Island languages, and they have this category of other languages, and they lump a bunch of stuff together. So they have Native American languages in there, Arabic there, then they have African languages that are there, and these are many, many, many languages deep. But again, for you to really look at what is all the languages that are spoken in the United States. This again is another snapshot from the census. 99% of the nation's households speak English or one of these 12 languages, including Spanish, Chinese, Vietnamese, Korean, Russian, Arabic, Tagalog, Polish, French, Haitian Creole, Portuguese, and Japanese. So we have a rich history in this country of having multiple languages that are indeed spoken. This, I think, is really important as you think about this in terms of state respite programs and also all of the providers. There's a concept that the census used entitled limited English-speaking households. They used to call them linguistically isolated households, but they changed that terminology. And this is households where nobody over 14 years of age speaks only English or speaks a non-English language and also speaks English very well. I think this is significant. And so as you think about how are we engaging all people across the country in respite services. So if you look at these estimates, 4.4% of households fall into this category. Again, these are estimates. However, when you look at the groupings, there's significant differences. And many people are surprised where we look at the percentage of Asian and Pacific Island languages is greater than Spanish, because most people would typically think that is indeed Spanish. So again, important information. What does this look like in your own state? What does it look like in your own local community? And so I say that as a backdrop to sharing with you what is linguistic competence. And a colleague and I created this definition for linguistic competence, particularly when many legislative issues were passed that kept referencing this. And so we look at linguistic competence as what an organization is able to do, including their personnel, and how are they able to really communicate with people in an effective way. And so can they convey information in a way that's easily understood? And this could be by a variety of people. Those who may have limited English proficiency, those who may have low literacy skills, those who may not be literate either in their language of origin or in English. It can include people with disabilities who have communication issues, and it can include people who are deaf or hard of hearing. So in other words, if we're providing respite services, we need to be able to do that across all of these different communication needs within our communities and within the states. We also, I should say states and territories, and I'm correcting myself to be able to say that. So everywhere where I said states before, pretend I also said territories. All right, and so as we look at this whole concept of linguistic competence, it means that we have to deal with health literacy and quite frankly, mental health literacy, so that I could have a PhD in math, but not have the greatest skills in terms of health literacy. And so that's an important consideration. And then it also says that for respite programs across the country, that in order to have this capacity, there have to be policies in place, structures, procedures, and importantly, dedicated resources. Sometimes I read grants for the federal government, and then I will read that from the particular entity submitting the grant, that they are going to reach a particular community with a variety of languages spoken. I go straight to the budget to see, has anybody allocated fiscal resources in order to do that? And I often find that people will say that that's what they're going to do, but they don't do part of the infrastructure, which is budgeting for it. So again, this is how we think about linguistic competence. Many of you know of the Civil Rights Act of 1964, and it says that nobody can be discriminated against because of race, color, or national origin. And it was like, well, what does that have to do with linguistic competence? Well, the concept of national origin does, because that's where we get language. And so based on this act, we can't discriminate against people if you're receiving federal funds for individuals that may speak languages other than English. And who does Title VI protect? It protects everyone. And I think this is really important because it is a law, it is not new, it's been around since 1964. And Title VI protects against national origin discrimination that is not limited to US citizens. I'm gonna say that again. It protects against national origin discrimination and is not limited to US citizens. And so this is really important information to be able to convey to those communities that may be affected, but also to ensure that your programs are complying with this. All of these slides are reference slides for you, so I'm not going to go through them, but I wanted to make sure that you had them overall. This talks about who's covered under Title VI, and again, lots and lots and lots of entities. There's a resource there for you to find out more. Again, I'm just going through these. This is a really excellent resource, and it really talks about Title VI in a way to ensure that if you receive federal funds, and that means directly or indirectly, so that say, for instance, federal funds can come to the state entity and then goes to like a nonprofit organization. The responsibility for Title VI passes down from that. So now we have reflection question 4. So I want you to just put your question 4 there so that Jill can have these responses. So do you know if the respite program in which you are an employee or a volunteer has language access implementation plan? And that's required by federal law. So that if you're receiving federal funds, you should have in place within your organization this language access plan that spells out how you're going to ensure that people who speak languages other than English are able to get those services. So I want you to be able to do that. Let us say yes or no. And then how familiar are you with this plan? Are you very familiar with the plan? Are you somewhat familiar, or you're not familiar at all? So I'll wait just a couple of seconds so that you can get busy in the chat feature and to respond to reflection questions 4. Okay, I see that it's flashing, and it looks like people are indeed entering their comments in. Again, all of this will help Jill as she looks forward to continued professional development and other training opportunities for this network. Health literacy is very important. I'm not going to go into great detail, but as we think about health literacy, the first way it was conceptualized was that from the U.S. Department of Health and Human Services is that the onus was all on the person, so that they had to obtain and process and understand basic health information and make their own decisions. The newer thinking about this is the work of Rima Rudd, who's at Harvard, and we kind of call her the queen of health literacy, that it's basically saying that professionals in healthcare institutions or related institutions, that they have to change and think about what it is that they do, and that they need to ensure access to information to support the active engagement of people. That's a very different way of thinking than what we were thinking about in 2010. So health literacy is very important. And this just, again, I have a resource for you, just said that we can't think about health literacy without also thinking about culture. And again, important, you can read this on your own, but there is a clear link. Now, let's revisit the scenario. This is the State Respite Coalition has been meeting to address disparities. And again, the analysis of the data indicate that there's underrepresentation both by geographic locale and by diverse racial ethnic groups in the families that access the care. And so again, after what we've shared, what are the cultural factors presented in this scenario? So I want you to think about it, and I want you to get busy on the chat feature again. And you can just write scenario. What are the cultural factors? You know, what do we see going on in this? And then what would you recommend around community engagement? You know, what do you see that you would recommend if you were part of this group that would be dealing with some of these issues of strangers caring for their loved ones, or lack of trust of human service providers, or the fact that people just don't know what respite is? So get busy with the chat feature and share your thoughts. I wanted to conclude this before we turn things over to Jed, is I got to thinking last night, and so I was like, okay, so could we take the cultural competence framework and then really do this crosswalk for respite services? And this is what I came up with. It was late last night, so it is not my perfect work. All right, so if we look at value diversity, we have to be able to acknowledge and respond to cultural diversity among the families that are in need of respite care across the lifespan. So that tells us we're valuing diversity. We have to ensure that the State Respite Coalition is representative of the diverse populations that reside within the state. Because how will we know how to reach groups if we don't have representation from those groups in that network? The next is being able to conduct self-assessment. So assess the extent to which the State Respite Coalition addresses cultural and linguistic competence in their activities, including in advocacy, in networking, in public education and training. Again, it shouldn't be separate and apart. Next is manage the dynamics of difference. So this looks at learn and respond to the array of family beliefs and practices that affect access to and utilization of respite care. Our fourth one is embed cultural knowledge. This is to ensure that employees and volunteers have the knowledge and skills that they need to provide respite care or other kinds of related services, including referrals, et cetera, to linguistically and culturally diverse populations. And lastly, adapt to diversity. It's really looking at, you need to go back and revisit your organization. You may need to revise some of your policies or your procedures or your practices. You may need to look at your budget to ensure that you're taking culture and language into consideration. So I'm going to end on this slide. And it says, as a culturally competent, you fill in the blank. It used to say manager. We got permission from a county department of health that felt that they were doing well, but they weren't serving all of their, all the populations in the state to the best of their ability. And they went on this journey toward enhancing their cultural competence. And so it used to say culturally competent manager. We asked them if we could take that out. And so I'm wanting you to think about what you would put in that blank. But I am capable of interacting positively with people who do not look like, communicate like, move like, think like, believe like, act like, love like, live like me. And I love this. I think it's just really very powerful because that's the essence of what we're talking about in terms of cultural competence, at least at the individual level. We had some new ones that were added in that used to say talk like, and we know that everyone doesn't use speech to communicate, and we changed it. Also, the original one didn't have move like there. We were in, I think, Massachusetts, and a person who was a participant, and this is many years ago, said, I really like that, but can you put move like me there? And then probably the most recent addition is love like. We have Health Disparities course lecture that we do at Georgetown University, and a student came up and said, I really like that. And whenever the students tell you that they like something, you pay close attention. And it said, can you include love like me there? And there are probably a number of other kind of like me that you could put there. But I just want us to really think about that we're all cultural beings, because we are, as humans, we're all cultural beings, and that culture really permeates every aspect of our life. I think that sometimes we simply don't see it, our own culture in particular, until we're confronted with a culture that may be different than our own. So with that said, I am going to close out, stop sharing my screen, and turn things over to Jed.
Well, let me interrupt for 1 second, Tawara. I just wanted to thank you for a very thought-provoking and a very rich presentation. I certainly learned a lot myself. There haven't been any questions coming in, but there was one comment here that I just wanted to read aloud because I think it speaks to a lot of what we're all facing. And it was a comment saying we're not always prepared to meet the diverse needs of people. Not that any program doesn't want to, it's more of meeting the challenge through staffing, budgeting, and access to those populations, education or experience of staff to address the comfort level of people that do not trust strangers to care for their loved ones. And I think you touched on all of those issues, but I didn't know if you wanted to address that a little bit further in response to the comment.
Okay, thank you for the comment. It's a very insightful comment. What I think it says to us is that this work of cultural competence isn't easy. That's why I think I said earlier, like, it's not a workshop, you know, it's not just reading a book, it's not watching a video, it is what you put into practice each and every day. And so you brought up a range of things. I'll just really quickly only touch on a couple of them. I think that when we look at where our country is right now and the kind of, I'm just say, social political environment that we find ourselves in, that this work in cultural competence probably could not be more needed, yet more people may tend to shy away from it because they may be reluctant because of fears of how will it be received, are you gonna get pushback, and that sort of thing. I think when you're doing the work of helping to understand difference, you're going to always get pushback. So it doesn't mean that you stop the work or that you slow walk the work. It just means that you have to really think about how you approach it. So one of the things I really like to do is help people to understand that we're all cultural beings, and that the work of cultural competence is about responding to each and every family from their own cultural context. And so my email is available. I think this is a much longer, deeper issue with that. That's why we look at doing organizational assessment, which Judge is going to talk about now, to see how are you thinking about culture and language in the services overall. And one other thing that I think is very important is that while I didn't mention it specifically, because of the nature of our country, and that because we know that racism and other isms are alive and well, you can't do this work without addressing those issues because they're alive and well in the lives of people. And so I encourage you to go to our website. We have many, many, many resources. And I know just by your statement that you are on the path to the journey, and it's one step at a time.
Thank you very much, Tora. Thanks again for that wonderful presentation. I am now going to turn it over to Jed. We will have an opportunity after his presentation to respond to additional questions. So feel free to keep typing them into the chat box. And we will get to them hopefully at the end. Let me advance. There you go, Jed.
Perfect. Well, it's great to be here, and I will take the opportunity to introduce myself a little bit further, but I do want to say it's just a privilege to have worked with Tawara. I've heard her on a number of presentations previously, and every time I have the privilege and honor of listening in, I always learn something new. What I wanted to share today is, how do we move forward and take some positive action, not indicating what you need to do, but giving you a framework organizationally to take some active steps forward. As we mentioned, I think now is a very important time to really begin to build forward momentum. So we'll move on to the next slide. And I'll just begin by saying howdy, which is, in addition to wearing a hat, kind of another one of my trademarks. And as Jill said, I have the privilege to work for CARF International. I've been their Managing Director of Aging Services for a couple of years now. But as we begin to think about cultural competencies, I want to share a few other things about myself. And I thought it was a great, thinking of Tawara's exercise on the iceberg, share some things that are below that waterline and begin to think about how does your organization, would you encourage me to share this information if I was seeking respite? Would you discourage me from sharing this information if I was seeking respite, or someone from the constellation? Would this information, kind of be integrated into your care plan? So I'll just share that I am a long distance caregiver for my 94-year-old mother-in-law who lives in Western PA. We're now contacting her multiple times a day in this era of social isolation. I've been married to my husband for 7 years, although we had a commitment ceremony 28 years ago. And we were together for 33 years. Just to know, he's African-American. Don't tell him I told you, but he is a little bit older than myself. Interestingly, we're both close with our family, our biological families, but every holiday, and we communicate via Zoom, via email, via telephone, 2 to 4 times a week with 2 other friends of ours. And these truly are individuals who are, our family of choice. Finally, I'll just share that both my husband and I attend church regularly. We're very active in our church. And again, would my friends be part of your care plan? Would you be able to elicit from me and kind of understand that that family of choice is probably as important, if not more important to us than perhaps even our biological family? it's clear in aging services, and I'll just share one little story before I move into things, that we do have a long way to go and there's still a lot of work to be done. I was a CARF surveyor for many years. And so I went out to an organization who it was an aging services organization. They did provide respite services. They shall remain nameless. But interestingly, as part of their diversity and cultural competency plan, I asked them the question, how have they addressed sexual orientation as part of this planning process? And they were very quick to respond. And they said that they've reached out to the local authorities, and to quote them, they would immediately notify the police if that issue ever came up. And you can imagine, you know, how I felt personally and professionally when I heard that. But it's also an opportunity for learning. And that was really an opportunity for me to share with that organization that that's not what is meant, and that's not the intent of cultural competency and diversity planning. Unfortunately, like I say, we in aging services and respite providers, you know, many have made significant progress, but I will say there is a long way to go. So we can move on. I won't take up too much time, but I just wanted to say that, you know, for those of you who aren't familiar with CARF, we're an accrediting entity. We're an independent nonprofit established in 1966. Interestingly, as a surveyor, I will say and share with you, we're a global organization, and I had the privilege of doing an accreditation visit in Abu Dhabi and Al Ain in the United Arab Emirates. And I will say that was probably not only the most fascinating, but truthfully, they were the most person-centered provider that I ever had visited. And I think I went into it, as Tawara said, you know, looking at it through that mirror and kind of expecting, coming from the United States, that I was going to be sharing all kind of insights. But truthfully, I learned so much more, and it was a very humbling experience for me and a learning experience for me, particularly about culture and cultural competence. And that's enough said. You can visit our website if you'd like to learn more about CARF or reach out to me afterwards. So I'll move on to the next slide. And I just wanted to actually quote the NCC and just say, achieving cultural competence is a long-term commitment, but remember that it's accomplished one step at a time. And so what I want to charge you with, and I think what Tawara, Jill, and my hope is that after we close out today's webinar, that you take one step, well, I think we're hoping you take even more than one step forward, but I really am encouraging you to take some action, that you don't just listen to this webinar, but you bring this webinar to life in the organization that you're a part of on behalf of Respite Services. So we can move on. And again, I don't want to go into great detail about a definition of a plan. I think people are familiar with it, but I will say the focus on moving forward is to do so in a planful and committed fashion. And what is most important is hopefully this framework will provide you an opportunity to spur a respite provider to move forward in concrete, productive, and informed action. So moving on, I think we have all seen, and this first emerged in 2020, if you go to the next slide, that plan, do, check, act model. It was, you know, kind of made most famous by W. Edwards Deming. But a couple of things that I want to point out is that that planning model really promotes action versus inaction, and it also promotes performance improvement. So out of the gate, you're not always going to get things right, but it has you assess that, react to that, and I think oftentimes, you know, greatness gets in the way of doing good, to use another quote. And I think what you want to do is really take actions moving forward, but use it as an opportunity for learning for yourselves personally and professionally, as well as your organization. And what I will say is that if you engage upon cultural competency and diversity planning, not unlike a good wine, it gets better over time as it ages. So let's move on to the next slide. So here you'll see cultural competency and diversity planning listed as part of strategic and overall business planning. I want to make 2 points related to this slide. One is cultural competency and diversity planning as a process is not a nice thing. You know, it is a nice thing to do, but it's not nice to do. It's essential to do. So it's as essential as your succession planning. It's as essential as your risk management planning. It's as essential as your financial management planning. So I want to first make that point, that you really need to integrate, and I would encourage you and urge you to integrate cultural competency and diversity planning into your overall planning processes. The other factor that I want to emphasize as we look at this graphic is it's not to be viewed in isolation. So it's not like you have your cultural competency and diversity plan, but when you're doing accessibility planning or technology planning or health and safety planning, what are the cultural competency and diversity aspects, and how are those interwoven into all aspects of risk management, performance improvement, succession planning, and ultimately not thinking about it in isolation. So we'll move on to the next slide. And I think this, you know, if you want to remember something, just remember this imagery of the tapestry. And I want to say that themes of embracing diversity are like a tapestry woven throughout all business planning processes. And I'll say that again. Themes of diversity and cultural competency are like this tapestry, and it really needs to be woven through all your business planning processes. We can move on to the next slide. So this just highlights the standard that exists in CARF accredited organizations, would reflect conformance to this standard. And let me make a couple of points related to that. One is it's broadly and holistically defined. So it's looking at a variety of stakeholder groups. So it would be looking at person served, personnel, staff, volunteers, members of your board of directors, vendors, and others. It's also kind of holistic. If you look, it lists out here culture, age, gender, sexual orientation. I do want to make one point specific to what Tawara was referencing. And I do know that this framework, having a list and also the grid format that we'll be sharing and that I've shared as part of that cultural competency and diversity plan, those formats do not always lend themselves to the concepts of intersectionality. So I want to reflect back on what Tawara said. So as you're addressing this, you know, a list format, you tend to think about each of these in isolation. Please don't do that. You really need to think about them and the intersectionality and how that will impact that as the interconnected nature of social categorizations that often overlap and intersect in interdependent systems of disadvantage. So I want you to keep that in mind moving forward. I also want to highlight, and I highlighted here, implementing. And plans are not just crafted, they're not just drafted, but plans really need to be implemented. And that's why I highlighted that word, and I'll come back to that later as well. So we'll move on to the next slide. The intent is that respite providers should be able to demonstrate an awareness of, a respect for, and attention to the diversity of people for whom the program impacts, and that this will be reflected in attitudes, organizational structures, policies, and services. So again, back to some of what Tawara said, it really impacts all those different aspects of your organization moving forward. So we'll move on to the next slide. What I tried to highlight here is reaching out to those aging services providers who have implemented and have embraced cultural competency and diversity planning. what were the key elements that they found organizationally to be successful in implementing and making changes in this arena. So a couple of things that I wanted to highlight, and I'll just briefly go through these bullet points. So one, this process needs to be a priority of your leadership. So it needs to be a priority of the board, a priority of the CEO or executive director, a priority of the leadership team. In order to be successful, it really needs to be embraced as a priority at that level. Relatedly, and kind of Tuara referenced this as well, you need to allocate the necessary resources. That'll be financial resources, that'll be staff time, training resources, talent, etc. You're not going to be successful if you don't allocate resources to this in an appropriate fashion. It needs to be a holistic approach. So it's not just looking at, cultural competency and diversity planning as it relates to the Respite program. If you're part of a broader organization, it needs to be thought about across all programs. We talked about making it a priority of leadership, but it needs to be thought about at all staffing levels and across all business processes. So really thinking back on that imagery of tapestry. In order to do this, you need to track and implement this. I know how I work professionally, and if I have a plan and a due date and a responsible person, I'm going to take that action in a timely fashion and follow up and monitor my progress. So this methodology or framework is really going to urge you to take action moving forward. It's important, and I think we referenced this previously as well, to build linkages within your community. As the adage goes, we are stronger together. So really thinking about who are the culturally relevant leaders, culturally relevant organizations, culturally relevant institutions that you can collectively reach out to, and I'll address this in another couple of slides. And finally, begin to think about how you're going to measure success. If you aren't able to articulate what success will look like, you're not going to be able to acknowledge your achievements or be able to kind of recalibrate your efforts if you've missed the mark in some way. So just begin to think about what is success going to look like as the result of taking actions in enhancing cultural competence within your organization. We can move on to the next slide. So I do want to give credit for these next two slides and encourage you to reach out and take a look at, if you're not familiar with, the toolkit for serving diverse communities from our colleagues at ACL and AOA. But they talk about, and Tuara also has some great resources on the NCCC website. But begin with assessments, a holistic, assessing the organization, doing personal assessments of various stakeholder groups. It's an important action step if you've not already taken it. Also want to make the tie to the social determinants of health, and that those, it's important to think about that in the broader context. And there are a number of great resources in that field that can inform this assessment process. So let's move on to the next slide. Again, I want to acknowledge the ACL AOA toolkit to enhance your knowledge related to this. But it really beginning to identify what resources are available in your community. Partners such as churches or sororities or fraternities, the Deltas, the AKAs, the Kappas, or thinking about a local bodega or even a neighborhood store. There are a lot of community partners, and you need to consider that broadly as you're thinking to engage them as part of your program. I do also want to point out, and there's a couple of valuable resources if you're not familiar with the Community Health Needs Assessment. That provides valuable information about what your community looks like in the broader community in a variety of different aspects as it relates to differences and social determinants of health. So I would encourage you to take a look at that data as well as an important action step moving forward. We can move on. When you take a look at the handout that I provided, it was a separate PDF. This slide just captures what are the narrative elements that would make up and begin to start the framework for organizational cultural competency and diversity plan. So if you take a look at that handout, you'll see that it begins with a commitment of visions and values. It also lays out key definitions. It looks at statistics, current personnel. They did a comparison. You'll see this was an organization that allowed me to generalize their information. So ABC Inc. Did their analysis, and they looked at potential hires that were coming in and those that ultimately got hired. Again, for if there are HR, human resource professionals, I do want to say that they gathered this information. It was not questions that were asked as part of the interview process, but it was gathered voluntarily and anonymously. People shared that information, but you can then do a comparative analysis and look at things like what does it look like if those statistics reflect that your volunteer network or that your staffing network, you're not hiring as many people with disability or people of color, for example. This organization also conducted a review of their employee handbook, a review of their policies and procedures manual, a review of their consumer handbook, and laid out all the areas that cultural competency and diversity was addressed in each of those documents. And again, if you haven't done that as an organization, that's a helpful first action step as part of that process. And finally, they laid out how, who was involved in reviewing the plan and developing the plan, who is involved in updating the plan, how is this plan shared with the people they serve, how is this plan shared with staff members. Again, this will help keep your organization on track. So we'll move on to the next slide. And this is just a graphic grid spreadsheet. And again, I mentioned that it doesn't really lend itself to intersectionality, so I want you to think about it. But again, it outlines a variety of different areas, gender identity, gender, spiritual beliefs, language, race. It encourages you to look at who is your intended audience. Is that going to be person served, personnel, or other staff? What are some areas of performance? And we'll talk about that on the next slide and go over some examples. Who is your key intended audience? And then again, what are the resources that are going to be needed? Who's going to be the responsible party for following up? What's your time frame? Again, I would encourage you to use this structure to hold your organizational accountable moving forward. Let's move on to the next slide. And here are just some examples of potential areas of impact or performance areas. So if you're taking actions, are those actions going to be related to governance, are related to communication, human resources, organizational infrastructure? So let's move on, and I wanted to finally just end up by sharing a couple of examples. So these are examples of, that come from organizations who are providing respite, and what are some of the action steps that they identified to address some of their organization and enhance organization capacity. So this is, they set forth as their broad goal to build the organization's capacity to execute cultural competency and diversity planning. So they established a committee. They wanted to be sure to include a board liaison. They conducted a kickoff meeting. They crafted a charter. They talked about conducting assessments of key stakeholder groups. So looking at demographics, being able to assess the knowledge and awareness of their staff, hosting a focus group, and they wanted to assess and access resources. So they not only identified community partners, but reached out to key community partners. They did an assessment of training resources and curricula that they could implement. Many of those resources to conduct those assessments you could access on the NCCC website, for example. So again, this is just one goal that was set out by a respite provider, and it gives you an example of how they're committing themselves to make some forward momentum in this area. And here's another example. Move on to the next. So this provider wanted to ensure that the respite assessment screening, and marketing materials were culturally respectful and are responsive to diverse cultural beliefs and practices, preferred languages, literacy, and other communication needs. So again, they were kind of bringing to life some of those things that Tawara was referencing in her presentation. So part of the action steps that they identified was to review all of their tools and materials that were currently in use, review and particularly looking at them to ensure that all forms contained inclusive, gender-neutral language, gender-neutral graphics, and that it allowed for self-identification. They wanted to formally assess literacy levels and make modifications if they were needed, ensuring access to translation services, but also wanted to consider enhancing their multilingual staff proficiency. So here are a couple of resources that I've shared here. So for example, going back to thinking about myself, if I'm visiting, a website, if you have, pictures that show and reflect, a gay couple, a mixed race family, if you have a rainbow flag as a symbol on your website, those are all things that are going to encourage me to consider seeking services from your organization. And they might be, part of this overall assessment process. I do want to highlight, for example, here, it's a great resource, the Long-Term Care Equality Index and the Healthcare Equality Index that are provided by our colleagues at the Human Rights Campaign. Some great resources, and I would encourage you to check out the other resources that are listed on this slide. So let's move on to the next slide. So what are your next steps? And I encourage you, well, I actually urge you over the next 30 days to really commit to identifying an area or two that you or in your team are going to take some action. Take the time to identify your overall goal, identify action steps, who's going to be responsible, and really commit the necessary resources to make some forward momentum. I really think the time is now to take action, and I would encourage you to do so moving forward. And I'll close on the next slide with the words of a tennis great, a great humanitarian, and a great civil rights leader, Arthur Ashe. Start where you are, use what you have, and do what you can. Thank you.
Thank you very much, Jed, for that wonderful, again, another very thought-provoking presentation, which also gives us, both Tawara and Jed have given us some wonderful tools to work with stepping forward. And my brain is rushing, but I really want to hear from all of you. And let's see what we've got in the chat box. Doris from New York says that she serves on the board of an organization that has made this a #1 priority. They hired a chief diversity officer to oversee the integration of these principles throughout the organization. They went so far as to do an assessment of the staff to find out what generations their staff are from, what the strengths, communication strategies, and learning styles to support their staff education need to support their cultural diversity efforts. And she's striving to share this model with her own organization, and that does sound very exciting.
Well, what I would encourage you to do is a couple of things. One, be sure to pull that together into a proposal presentation. Hopefully next year we'll have the opportunity to get together, but I think, everything, Lord willing, I'll be attending, and hopefully you'll be attending, but would love to think about you being a presentation and really sharing that as a resource. I don't think we have enough resources on the Arch website and other places. We certainly can enhance that. That sounds like a great model, and hopefully you'd be open to presenting that at the international conference.
Yes, absolutely, wonderful idea. Any other questions for Jed or Tawara? Or comments? I'd also love to hear from those of you who are part of our network, or even if you're not officially part of our network, if there are additional training and technical assistance opportunities or resources that Arch can share with you. I think Jed is absolutely right. A lot of those resources are deficient on our website, and we have a great deal of self-assessment to do at Arch as well, and we plan to do that. There will be a recording, as I mentioned at the beginning of this, so we just had a question. In the next day or two, if you registered for this webinar, then you will receive a link to the recording as well as the PowerPoint slides. The PowerPoint slides have also been posted earlier in the chat.
All right, so this is me, and I saw just a few typos that I'd like to correct. So I will send it to you, Jill, and you can decide what to do with it.
Okay, that's wonderful. We can resend them to everyone, and we'll also make sure to post the corrected version on the website. Any other questions or comments while we have the opportunity to hear from these two experts in the field? Just lots of very positive comments about the presentations. One presentation from Kim Whitmore in Wisconsin. She says, thanks for these great presentations. I find most organizations strive for increasing diversity and inclusion, but at the end of the day, it comes down to individuals being truly open to and embracing it in their daily lives, not just in annual required diversity trainings.
Jill, comment about that. Thank you, Kim, for your for sharing that in the chat feature. I will say that in a lot of the technical assistance requests that we get at the National Center for Cultural Competence is that people want to use training as the vehicle for organizational change. And training is really important. However, training doesn't get you to change policies. Training doesn't, in and of itself, change position descriptions. Training has its limitations. And so, as Jed was saying, in terms of really looking at the whole organization, that we have to look at training and we have to look at many other things in terms of what it is that we do each and every day. I often, I didn't do it this time, have a slide that has images of Tina Turner, because like I'm that age category. And she sang a song a long time ago that said, what's love got to do with it? And I often change that to say, what's culture got to do with it? And if you ask that question, what does culture have to do with it? You would be surprised of what comes to you just simply by asking that question. So think Tina, think Tina Turner, think what's culture got to do with it?
That's wonderful. Thank you, Dora. Any other thoughts, comments, suggestions for next steps? I'd love to hear those too. Any other last words from our wonderful presenters? We are coming close to 3:30.
All right, so I would just say thank you for the opportunity. I love this work. I've been doing it for many, many years. I am enthusiastic about anyone who just wants to look at how do we serve everybody and how do we serve them in the way that they both need and prefer to be served. And I thank you, Jill, for the invitation. Thank you, Jed, for, for recommending me. And I look forward to future collaborations with Arch in terms of its work.
Well, and I do want to say, like Tawara shared with us, that she perhaps has, interestingly, a longer tenure in Respite than either Jill or I. She was sharing with us that she's had a commitment, and Respite has held a dear place in her heart for decades. So we really appreciate your leadership in this arena. And I would just, again, encourage you to, you know, organizationally, to really make a commitment to making forward momentum in this important arena. I think the time is now for action. A lot of providers, you know, you can make a great statement of commitment that your executive director has crafted and post that on your website, but that's not enough. It's not, okay, you know, there's a lot of work that goes into this, and I believe and have learned across my professional career, unless I'm tracking that, monitoring that, holding people accountable to that in a framework for moving forward, oftentimes it gets pushed to the back time and time again. So I would encourage you and urge you to make a commitment, to begin to move forward, and just taking some small actions that the ball will begin to start rolling. And I think you'll see bigger things moving forward. And it was a pleasure to be here. And it's always a pleasure to be part of the Arch Respite team.
Thank you again, both of you. I think you gave us some wonderful information, new knowledge, and the tools to actually help us do that, Jed. And I take your words really to heart that we at Arch will make a commitment to collaborate with both you and Tawara to move these issues forward and help our network develop greater expertise and knowledge in this area. So thank you both very, very much. Please, one last request from our to our webinar attendees. You will receive in your inbox when you leave the meeting a very quick survey to just give us your feedback. You gave us some wonderful feedback already in the chat box, but if you would also respond to that quick survey, we greatly appreciate that. So have a wonderful afternoon, everyone, and hopefully we'll be scheduling another webinar or some other technical assistance in this arena in the very near future. Thank you all very much. It was wonderful. Bye-bye.